Greetings, everyone. We're so glad that you are joining us for this fantastic webinar about early intervention and what states are working on and succeeding and what their challenges have been. While you're popping in, go ahead and put your name and where you're joining us from. It's always fun to see who's here and what all the different roles are that folks have. My name is Michelle Adkins. I am with the Prenatal to 3 Capacity Building Hub, and we are thrilled to be able to bring you this webinar today. And so I'm going to hand it off to Karen, and she is going to facilitate for the rest of the day, mostly till the very end. Thanks, Karen.
Hi, everyone. I'm so happy to be here today, joining all of you and the panelists to talk about early intervention. We can move to our agenda. Just wanted to give you a little bit of the lay of the land for our day today. You're all welcoming each other into the chat, and our panelists will be introducing themselves shortly. The way we're going to structure this is we'll have sort of 3 sections. The first section, our panelists will tell you about their organizations that they're joining us from and what their lay of the land looks like a bit for early intervention. They're then going to each share with you a struggle that they may be having with their early intervention system. And then we'll shift to the solutions that they're implementing. If we have time for questions and answers at the end, we'll be doing that. I will encourage you throughout the session to please utilize the chat. Let us know things that are resonating with you and things where you may have questions for the panelists today. We can shift to the next slide. So I'm guessing that most of us that are here today are familiar with the early intervention program, but just to make sure we're all in the right place here, we're here today to talk about early intervention, which is Part C of the IDEA, the Individuals with Disabilities Education Act. And as we know, this is the program that provides services and supports to infants and toddlers who have or are at risk for disabilities and delays, and to their families. And all of our states have early intervention programs. We may call them something different. We may house them in different state agencies. But we all have this program. So the program is focused on infants and toddlers at risk for or who have developmental delays and disabilities. That's really, really important for us to remember. We each in our states define what developmental delay is defined as, and we also are required to serve children who have medical conditions or diagnoses where we know that they are at substantial risk for delay. So there's a very important part of this program that's around prevention and mitigation of disabilities and delays. The program is designed to build the capacity of families to meet the individual needs of their children. So as we know here, it's really a coaching model. At its very best, there are 16 different services that are provided to the children and families. And we're really here to support the families to understand how to best support their own children. And we know that the research is really strong here on when we deliver early intervention services as soon as possible to infants and toddlers, the outcomes are great. They're wonderful for mitigating health concerns, for decreasing the need for special education services, and really for empowering families to know how to support and advocate for their children. I'm going to introduce you to the speakers, and then they're each going to say who they are. So we have Leanne Barrett here from Rhode Island Kids Count, Sadia Batul, who's the Early Childhood Family Lead for Early Childhood Comprehensive Systems and the Pennsylvania Office of Child Development and Early Learning. My colleague, Zareen Kamal, who's on our Illinois policy team at Start Early, Libby Sanye, who's the executive director of the Louisiana Policy Institute for Children. And I'm here just to moderate today, and I am also at Start Early. And before we shift to the next slide, and I pass it off to Leanne, I really am excited for today because while we often say that when you've seen one early intervention system, you've seen one early intervention system, we know that states have lots of discretion to design and implement their early intervention systems. We also know that there's a lot of commonalities as well. And there are wonderful things happening in our states for children and families through early intervention. And we're also confronting some really shared challenges. We're not yet serving the majority of children who are eligible for this service. And we know that in many of our states, we have a workforce crisis that's leading to waiting lists in our system. And we know that the demand for these services is even greater since we've all experienced the COVID pandemic. So I'm hopeful that we'll all learn here together today about some common issues that we're all experiencing, and even more importantly, how we can really address those and have solutions for them. So I pass it off to you, Leanne.
Thanks, Karen. And this is just my introduction slide. I'm Leanne Barrett, and I work on early childhood policy at Rhode Island Kids Count. We are a statewide advocacy organization, and we work on everything from prenatal all the way up through college. So I cover all of early childhood, pre-K, early Head Start, childcare, paid family leave, EI, various other things. And the biggest part of what I do is coordinate this Right From the Start campaign. You can find more about it at the website, which is rightfromthestartri.org. There's several Right From the Starts in America, but we're Right From the Start RI, and we work on advancing legislative and budget policies that help families with babies and young children. And there's 8 organizations. One of them you're going to hear more about later, Parents Leading for Educational Equity. But I'll stop there. Thanks. And I'll turn it over to Sadia next.
Thank you so much, Leanne. Hi, good afternoon, everyone. My name is Sadia Batul, and I'm coming here today with both a professional and a parent hat. I'll start by saying that I'm a parent of a wonderful 10-year-old now daughter who's a successful early intervention graduate. But I'm also a professional working with the Pennsylvania Office of Child Development and Early Learning, which houses our lead agency for the implementation of early intervention services, and that is the Bureau of Early Intervention Services and Family Supports. And a little unique thing about Pennsylvania is that EI in Pennsylvania is governed by both federal and state statutes. So not only does the Bureau of Early Intervention Services implements the Early Intervention Part C program or the Infant Toddler program, but it also provides supports with the Part B, Section 619 program of the federal law requirement. Therefore, Pennsylvania provides early intervention services to at-risk infants and toddlers or those with disabilities and or developmental delays, as well as to preschool children 3 years of age to the age of beginners who have disabilities and or developmental delays. On the next slide, you'll see an important partnership that is really supporting the implementation of early intervention services in Pennsylvania, and that is our Early Intervention Technical Assistance, which provides statewide training and technical assistance on behalf of the Bureau of Early Intervention. And the primary recipients of EITA's training and technical assistance are the local infant, toddler, and preschool programs that provide supports and services to children receiving early intervention services. And my focus today will be family engagement, and EITA plays a very vital role in supporting families of children receiving early intervention services with family engagement opportunities. And with that, I'm now going to pass it to my co-presenter in Illinois, Zareen.
Thanks, Sadia. Hi, everyone. My name is Zareen Kamal. I'm a policy specialist at Start Early. At Start Early, we are focused on closing the opportunity gap prenatally through age 5, and we do this through program delivery, research and evaluation, and policy and advocacy. I sit on the Illinois policy team along with Karen, and our team has a deep history of policy advocacy on behalf of children with delays and disabilities and their families. We do this largely through administrative, legislative, and grassroots advocacy. Start Early is also a federal Head Start grantee, and we have a consulting team that supports our partners with prenatal to 5 systems work. With that, I'm going to pass it to Libby.
Thank you. I'm Libby Sonia. I'm the Executive Director of the Louisiana Policy Institute for Children. And we are working in our state really to strengthen our prenatal to 3 system. And as part of this work and with the support of the Pritzker Children's Initiative, we're leading a public-private coalition to really strengthen the services, quality and accessibility in early care and education, health and well-being. And as an organization, our mission really is about advancing policies to ensure that Louisiana's youngest children are not only, successful in life, but in school as well. And that we really envision a Louisiana in which all of our young children, birth through age 4, are safe, healthy, and reach their full potential. And our work really seeks to be a source of nonpartisan, independent information on issues concerning children ages birth to 4 in our state.
Okay, so now we're ready to really get in the meat of it. We can move to the next slide. And here's where I'm going to remind everybody, either in the question and answer spot or just in the chat as you're listening, think about what's resonating with you, and the struggles and the solutions that you're advocating for or experiencing in your state. And provide any other reflections or clarifying questions that you may want from the panelists today. And we'll do our best to address those while we're here in this shared space. And we can also provide information after the session's over, in case we don't have time for that full conversation. So I'm going to shift now to the part where our colleagues, and you can show the next title slide, are going to talk about a struggle that they're having. What's a challenge that their state is experiencing in ensuring equitable access to early intervention services for all of their eligible infants and toddlers and their families. So I can pass it on again to my colleague Leanne in Rhode Island.
Thanks, Karen. Next slide, please. Great, thank you. So in Rhode Island, we have had a growing crisis in early intervention. We have a lot of problems I'll go over briefly right now, but we have been recognized actually as one of the best in the country. Massachusetts is usually #1, and we're usually in the top 5 in terms of numbers of children who are getting EI. But it's becoming increasingly more difficult. So we've seen significant growth, and more than doubling of participation of children. Our program is financed through Medicaid and commercial insurance. The Medicaid rates were established in 2002. They were cut in 2009 during the fiscal crisis, and they never received any even restoration to 2002. So in 2022, our Medicaid rates for EI were lower than they were in 2002. And the commercial insurance rates mirror the Medicaid rates. So commercial was also very low. Therefore, a lot of the EI agencies, which are nonprofits in our state, were trying to raise money so that they could attract and retain staff, which they were somewhat successful on for many years, became increasingly difficult. And then the pandemic really made a huge problem even worse. But they were often having to replace 50 to 60% of some of their staff roles each year, particularly the service coordinator and early childhood educator roles had very high staff turnover. And as we know with any program, a family loses their main contact and they get a new person who has to relearn them. They're more likely to drop out. And also it's just a huge burden on the staff who remain to get families assigned to them out of the blue and have their caseload go up until they can hire a staff person to replace them. So families often get more than one handoff, and that's very challenging. In November 2021, after we were coming out of COVID to some extent, the crisis got to be so bad that every single EI agency in the state said they cannot accept any more children. So the state created a waiting list, which grew to 1,000 children, which is very high in Rhode Island. Normally on a given day, 2,300 children are enrolled in EI. So we were able to work with our coalition of EI providers, parents, et cetera, right from the start. And we're able to get a 45% rate increase in 2022, and the state awarded $11 million of ARPA funding, which is just now ending, to help address the staffing challenges. They provided significant sign-on bonuses, et cetera, but we have not seen the waiting list disappear. We asked for a 70% rate increase, which is what we thought we needed, and we got a 45% rate increase. It has gotten better, but we still have a very stubborn waiting list. We also are seeing significant financing and staffing problems in our preschool special ed program for children ages 3 to kindergarten entry. In particular, in Providence, there were hundreds of children waiting for services who had an IEP, and a parent-driven lawsuit was settled, and the state and the city are under a monitoring problem. But we see, looking at data, significant problems in the preschool special ed system as well, which is exacerbated by children who didn't get EI, who are coming into preschool special ed without having received EI because of our waiting list. Next slide, please. So this is a slide. We work very closely with Parents Leading for Educational Equity, one of the 8 organizations that runs the Right from the Start campaign. And they have a group of parents. They're a grassroots parent organization. And a lot of parents actually are really struggling, don't even know enough about EI and they face barriers to access it. It makes it even worse. So these are recommendations and challenges that they have about not knowing that these systems exist, don't know who to call or where to call. We hear families who call the school district and ask about EI, and the school district person doesn't know about EI either and is not able to refer them to the right person to call. They have scheduling challenges and struggle to access services because they're working so many hours. They frequently don't see any people from their own culture or race or people who speak their own languages in either of these systems, which is much less diverse in Rhode Island than the regular early childhood system, which is very diverse. And a lot of them are really struggling to find any appropriate childcare for their kids who have special needs, which we know they require more individualized attention, and it just exacerbates the affordability problem that all families face. So with that, I'll turn it over to Pennsylvania. Sadia.
Thank you so much, Leanne. And I'm going to talk about some of the needs that were identified around family engagement and leadership. I serve as the Early Childhood Family Lead for Pennsylvania's Early Childhood Comprehensive Systems Health Integration Prenatal to Age 3 program, or as we call it in Pennsylvania, the ECCS project. And one of the central activities of our project was to conduct a systems asset and gap analysis to identify the strengths and challenges within Pennsylvania's maternal and early childhood systems, and that of course includes EI as well. And one of the focus areas for this needs assessment was family engagement and leadership. And not only did we review the existing need assessment, but we also conducted interviews of our prenatal to age 5 partners, and that included our families as well, and both families who have received early intervention services or are currently receiving early intervention. And these are some of the findings that were identified as needs in the family engagement. So as you can see on the screen, the first need that was identified, or the challenge, was invisibility of family leadership opportunities. There are several opportunities for families to engage as partners at the local and state level, but many times families may not be aware of those opportunities. And this was something that was not only identified by the families, but also for the professionals as well, because some of the professionals shared how they were not aware of some of the opportunities that existed outside of their program, or the local professionals may not be aware of state family leadership opportunities. Another challenge that was identified was barrier to access, such as transportation, language, technology. This was one of the themes that was most talked about by our families, especially for in-person family engagement opportunities. Transportation was identified as a big barrier. And then even if you're doing events virtually, not having appropriate technology really resulted in not a meaningful participation for the families. Another barrier that was identified was a lack of having family-friendly leadership opportunities. And we all have been in meetings where there have been acronyms and jargons that we're wondering, what are they talking about? So a lot of families talked about how sometimes when they're in meetings, they're engaged as partners, but they might not be able to participate meaningfully because there's a lot of that acronym jargon and systems language. I know from my personal experience as a parent, it took me about 2 years to understand Part C is infant toddler and Part B is the preschool program. So C comes before B. And then not having that standardized support for family engagement across systems, across programs, and especially the financial support, which really results in the lack of collaboration for family engagement between different system professionals. And finally, not having dedicated staff for family engagement. This was one of the themes that we heard a lot from our professional leaders. And even if programs do have a dedicated family engagement staff, that one person is not able to do it all. So we really need to have that dedication to engaging more family engagement consultants within the program. So these were some of the challenges that we have identified. And with that, I'm going to pass it to Illinois.
Thank you. So this was just a snapshot of our EI system in Illinois and who we serve. I do want to point out that we have a fee-for-service system. So our service providers are largely independent contractors, which allows them to work in EI and other places. They also do their own billing, pay for health insurance and transportation costs. This becomes important later on when we explore our strategies. Our service coordinators, though, are salaried and employed through regional points of entry through which families can access the program. There are 25 of those statewide, and they're called Child and Family Connections Offices. We are currently serving more than 26,000 children and families as of January. And to put this into context for those in other states, that is roughly 4% of infants and toddlers who are receiving services. And that's on par with the national percentage of children served. About half of families served are Medicaid benefit recipients. And we've seen that 43% of children are leaving the program functioning within age expectations. And 75% of those who don't have shown to substantially increase their rate of growth by the time they do exit. And the program serves children from all income levels and in every county across Illinois. So on the next slide, we see that while we have this amazing program that has been shown to be beneficial for so many children and their families, yet like everyone else across the country, we are still underserving and not reaching all children who are eligible. And this is due in large part to the workforce crisis that we are facing, just like many of you have shared in the chat that you're experiencing in your own states. When we looked at the data, we saw that providers and service coordinators are continuing to leave the field. We have lost hundreds of providers since 2020. We know that, this has been a longstanding issue, and COVID has only exacerbated that problem. And while we have had incremental progress through rate increases, we know that we have not really been intentionally addressing compensation enough for many, many years. So we continue to lose providers due to inadequate pay and high caseloads. This means that we are experiencing bottlenecks in taking in new referrals, and families are experiencing wait lists at every step of the process. So wait lists for services have more than doubled in just the past 2 years, and they remain high. We also don't really have a good way of capturing data on families who never actually make contact to the system and are unable to even enter the system. So that number is likely higher, even higher than the numbers actually show. So now I'm going to pass it to my co-presenter, Libby, to talk a little bit about Louisiana.
Thanks so much. And so Louisiana currently is currently 31st in the country in enrollment for children in the early intervention system in Part C, and 20th in the nation, really related to enrollment of children birth to age 1. And this comparative data really underscores the urgencies of improving our program enrollment. If we look at our eligibility criteria in Louisiana, it is one of the most restrictive in the country. A particular note is that the largest referral source into the Part C system after healthcare providers is actually the Department of Children and Family Services due to abuse and neglect. And so these more restrictive eligibility criteria were enacted in 2012 as a result of budget challenges prior to the 2012 changes. Louisiana, our Early Steps program, our Part C program, was in the moderate category related to eligibility criteria with 1.45 standards deviation in one developmental domain. The change to the more restrictive eligibility led to a drop of a little over 1,600, about 30% of our population and the number of children served, which at its height was about 5,500 in May of 2012, and then reduced, in that same year to about 3,900. What's happened over the last few years is that the number of children has actually rebounded to over what it was when that restrictive eligibility criteria came in place. And so part of what we have done at the Louisiana Policy Institute for Children is really try to help identify how more children could receive early intervention in our Part C system. And so we've actively worked with the Build Initiatives Prenatal to 3 Capacity Building Hub to really think about what are the strategies that could potentially help support Louisiana as we consider to increase participation in early intervention. If you look at our numbers, we're not in a good spot. We have more children that we need to serve. And when you're in a state that it's easier to get into that Part B service of 619 than it is into the Part C service provision, there's work to do. And so as we think about what does child find efforts look like and those types of things, I'm really excited to kick this back over to Karen as we talk about what are some strategies that we have thought about in our different states.
Thanks so much to our panelists. I know sometimes it can be overwhelming to hear a lot about the struggles, right? And we can get overwhelmed in that. And that's why I'm really excited. You can put the slide deck back up if you want. It's just, yes, around our solutions. That the good news is that there are solutions to a lot of these challenges. And all of the panelists here are going to be able to share with you things that they're doing to really address some of the things that we've heard. And I'm trying to track to the chat too. So for the panelists who are busy presenting, know that there are many of the participants here today who share similar struggles in their states, have also raised issues around the need for additional training and support for both folks who refer families to early intervention and sometimes for the providers as well. Particularly if we're treating particular populations of children. And so now I am going to transfer it back to Leanne to begin the section on solutions.
Thanks, Karen. So we have worked with a lot of data in particular and tried to make the problems be visible. I was shocked as an advocate who's worked in the field that I had no idea that we hadn't provided a rate increase to early intervention for 20 years. It was extremely surprising to me. And the only way I knew about it was early intervention providers reached out because we were running a big advocacy campaign on childcare and pre-K and Head Start. And they said, hey, you know what? We need some help. We're dying here. And in fact, as you get wins in other areas, particularly as pre-K expands, where they have bachelor's degrees in early childhood, we're losing our service coordinators who were going to take pre-K classes for the pre-K program. So just talking to the EI providers as advocates and for EI providers to reach out and organize yourself with advocates because it's very hard to move something forward by yourself. But if you work together, you can get almost anything accomplished. So there were some staff surveys that the state had done in the early childhood sector, actually with PDG funding. So we are not just looking at the childcare sector, but people who work in EI. And we saw lots of, early warnings that this waiting list was coming, with 82% of EI staff saying they were planning on leaving the fields or the EI fields and going to work somewhere else in 2018. Over half of them said they had already been looking for another job in the last 6 months. So we shouldn't have been surprised when you added the COVID challenge on top of that we just saw a huge staffing crisis. The other, advocacy organizations that have really made a difference is Parents Leading for Educational Equity. Having parents tell their stories it makes such a difference with legislators and policymakers and the media. Rhode Island Parent Information Network is another great organization that works a lot with parents, and they have been really important in pushing hard on the preschool special education topic as well. And then the American Academy of Pediatrics. The pediatricians talk to their families every single day and are constantly frustrated with their families not getting what they're entitled to. So the pediatricians can come to hearings or submit written testimony, which they do very effectively. And you can hear a pin drop when I have a pediatrician come to a hearing and explain what the situation is for families. They really make a difference when they're talking to legislators. We also produced a video, which I can put the link in the chat. It's on our YouTube page, which is a 3-minute video with a early intervention specialist explaining the challenges for her and having very low non-competitive wages, the challenges for the field, and also hearing directly from a family. It's a great short video that we did with real Rhode Island families. And we've worked a lot with the media. The Boston Globe, which covers Rhode Island, has been particularly effective, but this story of the waiting list was front page news in the Providence Journal on the day before Thanksgiving. All of the TV stations have covered it. Having a waiting list, if you have one, is something that the media should know about, and they should talk to families who are on the waiting list, particularly families who've been on for a while or whose kids age out while they're on a waiting list. So next slide, please. So solutions, I had mentioned already, we did get the 45% rate increase in 2022 and the ARPA funding. So that ARPA funding is drying up, as everyone knows. So we're worried again about that. We don't think the 45% rate increase was adequate. So we have been successful in advocating at the administrative level, and our governor Dan McKee, is recommending a 15% rate increase in his FY25 budget, which is under review right now with the legislature. And he talked about early intervention in his State of the State speech. So that was great news. I don't think we've ever had a governor talk about early intervention in the State of the State speech. We are introducing legislation with our sponsors who helped get us the 45% rate increase, and we're asking for a 25% Medicaid rate increase. We're also asking for a statutory cost of living adjustment so that we don't have to have a giant coalition and a bill every year in order to keep up with the cost of living. The other idea we have, last year we had a big win in getting free childcare for childcare staff. Following the Kentucky model, some of you may have heard Kentucky, in order to address the staffing crisis in childcare, is offering free childcare, covering the cost of childcare for childcare staff. And we've started that with a pilot, which has been very successful. About half of all the centers in our state have at least one staff person receiving that benefit. And we would like to add early intervention into that list as well, because we know that would be a powerful recruitment incentive to have even PTs, OTs, speech language pathologists who have a little baby, a young child who can figure out that they could, because they struggle to afford childcare, because we know 9 out of 10 families struggle to afford childcare. The last thing on here is that we are asking the General Assembly to establish and provide some initial funding to hire some smart consultants to help us figure out how do we fix the staffing and financing problems in the early childhood IDEA system, in both early intervention and preschool special ed, because we're stealing each other's staff. We do not have enough of a pipeline of people who are entering this field. And there's other challenges as well that we think if we had a public-private task force with EI providers, school districts, parents, pediatricians, working together with support, that we'd be able to come up with some clear recommendations that then as advocates, we can move forward with the administration and then with the legislature as well. So that's the end of my solutions, and I will turn it over to Sadia from Pennsylvania.
Thank you so much, Leanne. So yes, I'll talk about some of the solutions we have implemented to ensure that the needs of families are met around the family engagement and leadership opportunities. And as you will see on the screen, we have the cover page of our Pennsylvania Family Engagement Birth through College Career Community Ready Framework. And this is a guiding light for family engagement in Pennsylvania. It is a tool that guides the implementation of effective practices, use of shared language, and a family engagement continuum for families across their child's educational lifespan, and also supports families in their own leadership journey. The second document on the right is the companion piece to this original framework, which was created for families. In Pennsylvania, we're very inclusive of families, and when we talk about families, we have an inclusive definition. Families are those people who have intimate, caring bonds with each other over time and who take care of a child both physically and emotionally. And this includes our parents, grandparents, great-grandparents, foster parents, aunt, uncle, or other invested adults who love and care for a young person. And on the next slide, I wanted to bring your attention to our family engagement definition. And while I'll not read the definition in its entirety, but I wanted to highlight some of the key words. As you'll see, it says that family engagement is intentional, meaning, and impactful. So it really has to be not that one-size-fits-all model, because we understand that each family is unique. What works for my family may not work for your family. So we really have to make sure that we are meeting the needs of the individual needs of each family. And then leveraging the expertise, knowledge, and leadership of families. When we leverage something, it means that it already exists. So this is that understanding and acknowledgement that families are leaders. Every family can lead and are experts on their child and family, and then supporting them in their leadership journey. And finally, that these partnerships are strength-based, culturally responsive. Again, that it's not a one-size-fits-all model. And then it's two-way communication. So we're not just telling families what to do, we're really listening to them, we're understanding their unique needs, and then meeting them where they are. And then finally, I think this is one of the most beautiful parts of this definition, the shared goal. We're all working towards that common goal to support children and families. And so as partners, it's really important to keep that shared goal in the mind. Next slide, please. So in order to meet the provide supports for family engagement, I've categorized some of the supports that we have in Pennsylvania. And first and foremost, it's the commitment to making sure that families are engaged as partners, whether we're talking about partnering with families at the program level for their child's team, or partnering with them at the local state level for decision-making or improving policies, practices, and procedures. And then dedicated funding for all of our family engagement and leadership initiatives through the Bureau for Early Intervention Services and Family Supports. We have dedicated funding to support families. And I'll talk a little bit about this in detail in just a few minutes. And then training and technical assistance. While every family can lead and is a leader, we really need to make sure that families are provided with the knowledge, the resources, and the tools to enhance their leadership and advocacy skills. And we have a number of programs in Pennsylvania that provide that support to families. And finally, mentoring supports. While we do not have a formal mentoring program, but one of the things that we have in Pennsylvania is that all of our family engagement consultants are also individuals that have lived experience and really connect with families and support them in building their leadership and advocacy skills. I personally really benefited from one of my family engagement consultant who supported me in my journey as a parent and transforming from a clueless parent to a parent who is now confident and competent and equal member of my daughter's IEP team. Next slide, please. And so we're now going to play a short 2-minute video, which really reflects this commitment that our office has, that nothing about families without families, and really reflects the organizational readiness that's needed to engage families as partners in decision-making table, and the leadership buy-in that is needed to make sure that we're really making that authentic partnership with our families. And we're now going to play the video. Michelle, I'm not able to hear the audio.
Pennsylvania Office of Child Development and Early Learning, OCDEL, is committed to providing families access to high-quality services to prepare Pennsylvania's children for school and life success. To meet this goal, OCDEL values families as important partners in the decision-making process that impacts policies, procedures, and operational practices. We believe every parent or primary caregiver of a young child is a family leader. Parents and caregivers get to decide whether they want to exercise their leadership at the local, state, or national level, but it is always starting with being a leader of their child's team. As professionals, it is our responsibility to support parents and caregivers with resources and opportunities to enhance their leadership skills and become better informed, confident, and competent advocates for their children and families. Pennsylvania has a strong history of supporting partnerships with families within decision-making and initiatives. This includes ensuring family members are supported in their own leadership development and are provided with opportunities to share their experiences, expertise, and knowledge. This commitment is reflected in a variety of family leadership opportunities. This includes family memberships on state and early childhood advisory structures, family leader trainings, recruiting people with lived experiences in the workforce, and ensuring family leaders are compensated respectfully for both their time and expertise. Family engagement and leadership cannot be a one-size-fits-all model. Therefore, we are continuing in our efforts to develop innovative and culturally responsive strategies to ensure the unique needs of family leaders, especially families from historically marginalized groups. As we kick off celebrating National Family Engagement Month, I invite you to join me in making a commitment to ensure more family voices are heard, valued, and influential in decision-making at the program, local, state, and national levels. Visit www.papromiseforchildren.com and search for family engagement.
Thank you, Michelle. So that was our Deputy Secretary of the Office of Child Development and Early Learning, really reflecting that how leadership buy-in and organizational readiness is needed to provide clear expectations, dedicated time, adequate funding and resources to participating staff to engage in equitable family leadership work. And one of our programs in Pennsylvania that has existed for more than 2 decades. I like to call it the Superstar Training Program in Pennsylvania. It's the Competence, Confidence, Partners in Policymaking, Early Intervention, or C2P2EI. We love acronyms and we love RP in Pennsylvania. And this is a program that I've personally engaged as a parent. I feel I'm blessed that I was able to graduate from this program. It is a year-long training, leadership development training program for families of children receiving early intervention infant, toddler, or preschool services. And this is modeled after Minnesota's Partners in Policy, Competence and Confidence program. And what it really does is provides families up-to-date information on best practices, resources, and policy issues around early intervention, and also supports them in connecting with families across the state. Families who participate in the cohort are provided with supports to cover for their travel expenses, childcare reimbursement, as well as provision of other supports as needed by the families. And this program has produced hundreds of families across the Commonwealth that are not only engaging as important partners in their own child's learning and development, but as partners at local, state, and even at the national level are engaged in multiple family engagement opportunities. Next slide, please. This is another program that has existed in Pennsylvania, I will say, for more than a decade now. And again, I feel very fortunate that I'm also a partnered, I was really blessed to be engaged with this program as a parent myself. This was actually one of the life-changing programs, I will say, that transformed me from a clueless parent who had no idea what IEP stands for to now a parent who is confident, competent, and actually transitioned to a professional in the field of early childhood systems because of this program. And this is called Parents as Partners in Professional Development, or P3D. And this is a program that supports families with opportunities to not only become confident, competent in their role as parent caregivers, but also supports them in sharing their story, whether it's for pre-service learning opportunities or other professional development opportunities, and also engages them in a variety of family engagement opportunities at the local, state, and national level. And one such example is our State Interagency Coordinating Council, which is a governor-appointed council that supports the Bureau of Early Intervention Services in the implementation of integrated EI services. And through this program, we have a dedicated team that supports families to be engaged meaningfully in the state ICC meetings. We actually have what is called a family meet and greet. That is a meeting that happens before the actual state ICC meeting, which is exclusively designed for families by families, where families come together. The agenda for the actual state ICC meeting is reviewed so that families have the information and the resources that is needed to meaningfully and authentically engage within the state ICC meeting. And again, this program really makes sure that families, when they're brought together, are reimbursed for their time and expertise and other expenses that are needed for family engagement. Next slide, please. What I really wanted to focus as a solution was the 3 Ps of compensating family leaders. When we're bringing families to table, it's really important to value them for their time and expertise that they contribute as parents, as important partners in decision-making and enhancement of our system. And so the first and the foremost thing is having a policy. And we're really fortunate that through our Early Intervention Technical Assistance Office, which is identified by our Bureau of Early Intervention, to really establish that funding procedures for the reimbursement of families for their time and expertise. We have an internal reimbursement policy document that really ensures that we have consistent practices related to payment of honorariums and expense reimbursement for family members across the different family engagement initiatives that we have. We have a set rate of honorariums for most of our family engagement opportunities. In addition to honorarium or the consulting fee, families are also provided with reimbursement for childcare. And I will say both for the honorarium and childcare reimbursement, it is not only for the time that families are spending attending the meeting or co-presenting, it is also for the time they spend prepping. So if you are going to attend a 45-minute presentation, the time that you spend preparing for that meeting is you're also provided with that honorarium and childcare reimbursement. And then finally, all travel expenses for in-person events are also supported, provided to the families. In terms of the procedures, we have a dedicated fiscal staff for family reimbursement. This really ensures that reimbursements are processed in a timely manner. In addition to a dedicated fiscal staff, we also have dedicated family engagement consultants who work with families to ensure that any questions that families may have or any support that is needed to make sure that compensation is happening at a timely manner, those family engagement consultants are there to support them. And then family-friendly reimbursement form, really making sure that we're meeting the needs of our fiscal office, but also making the form as convenient as possible for our families so that timely reimbursements can be processed. In terms of practices, one of the, I would say, the really beneficial supports that are provided to families and that we hear a lot of good feedback is that instead of families making their own reservations, such as lodging and flight, if they are traveling for any family engagement opportunities at the state or the national level, they are not required to make that. Our fiscal office will do that for them. That really takes off that financial burden to put down hundreds of dollars when you are traveling and not have to wait for reimbursements to happen after a few days to a few weeks. In addition to that, on-site and individualized support is provided. So for all our in-person events and even our virtual events, we might have dedicated time to make sure if there are any questions related to reimbursements or honorariums that are answered. In addition to that, our family engagement consultants will also provide that individualized support that is needed to complete the reimbursement forms. I know in my time as a parent leader, this was one of the most important supports that I needed because I always was very late on submitting my reimbursements, and the family engagement consultants working with me made sure that I had all the supports needed to get those timely reimbursements. And then finally, timely processing of reimbursements is really important. So we have an internal procedure that really makes sure once the reimbursements are received, the check is processed in a timely manner so families do not have to wait for months to get those payments. Next slide, please. Just to wrap up, I want to say that there is a commitment in our office that every family can lead and every family is a leader. It always starts by being a leader of their child's team. Along the way in their journey, there may be local, state, and national leadership opportunities, and it is up to the family to choose where they want to exercise their leadership, but it is really important to provide them the supports, the tools, and the resources that's needed to further increase their leadership skills and to become confident, competent parents experience, and we have a number of family engagement and leadership opportunities that support families with that. And I will now pass it on to Zareen.
Thank you so much, Sadia, for that important perspective. For Illinois, I want to start by sharing a little bit about our budget advocacy from last year and what the outcome was. So last year, the governor announced a historic investment of $40 million for early intervention in his budget proposal, which included a 10% rate increase for all providers and service coordinators. There was a lot of advocacy to get this passed, and I want to talk through some of those efforts. So in addition to having a governor who, really understands early childhood and the importance of these programs, there was a lot of effort at the grassroots level by providers themselves and an authentic partnership that was built with advocates as well. So EI providers worked really hard to mobilize themselves. It all started with a petition that they started and got thousands of signatures for. They held their own provider meetings to raise awareness and activate others in the system. They created provider surveys to assess needs of the provider community, created fact sheets based on those results, all this on volunteer time and while still serving families, right? So coupled with that provider voice piece was also family engagement. Last year, over 100 EI families shared their stories through a virtual postcard campaign. And those postcards were taken to Springfield and delivered to legislators to truly show the impact of these critical services on children and families. And third, having legislators who really understand EI was critical. We were able to partner with champion legislators who held subject matter hearings and personally spoke with the governor about the need to do better for EI. So on the next slide, we'll see, that we got this historic win last year, but I'm sure many of you know we can't rest on our laurels and the struggle continues. So this year, we were really disappointed when only a $6 million increase to the EI budget was announced in the budget proposal for fiscal year 25, while advocates were asking for a $40 million increase. And there was a provider survey done assessing the impact of the 10% rate increase from last year and what that has meant for provider recruitment and retention. And of the 800 providers that responded to that survey, 80% said it did incentivize them to remain in the field. However, what it did not do is bring in new providers. And 30% responded that they would actually leave EI if no changes were made this year. So we see that providers are still underpaid, due to the decades of neglect. The state would actually need to raise provider reimbursement rates still by at least 25%. Just to for them to have the same real wage that they were given in 2004. So the governor's budget proposal for this year assumes that the system is functioning how it's supposed to, and it ignores the fact that we have thousands of families who are waiting for services and that providers are underpaid. With a $40 million increase, $20 million would go towards another 10% rate increase, and then there would be funds for maintenance and structural improvements to the system as well. So we can go to the next slide. We know that the budget proposal is just a proposal, and we have from now through the end of May to do everything we can to get more funding into the system. The main difference from last year to now is that all of this work went into just getting the legislature to confirm the governor's budget proposal last year, and that made all the difference. The advocacy for last year's budget actually began the summer before the budget proposal. Now this year, it's a little bit of a harder push because now we have to correct the course and then begin the advocacy for next year right away. So we're not missing the boat again or taking anything for granted. The providers started another petition, which has gotten over 2,000 signatures in just a month. We have 180 people so far that have taken action to send letters to their legislators. Through a quick and easy quorum action. We are having an early childhood advocacy day where we organize anyone who wants to come down to Springfield and advocate for early childhood. And then we're also doing the postcard campaign again to collect families' stories. We are also supporting families in filing complaints if they are experiencing barriers to accessing early intervention at any step of the process and are waiting longer than the required EI timelines. So we're partnering with Equip for Equality in our state to support families who need assistance with filing a complaint. And we have those resources available in Spanish and English. We can go to the next slide. To address our rising waiting lists and disparities in access, we knew that our solutions had to focus on both how we pay and deploy the workforce, and also that we may need different solutions for different problems. So in Illinois, right now, our entire early childhood system is going through a transformation as we shift to a unified single early childhood state agency, and our EI program is core to that. In 2019, our governor called for a funding commission to look at issues of access and funding equity, and that commission documented inequities in access and the need for making these changes. But we know, and the Funding Commission recommendations also showed, that we need to do more than just rate increases. We have to offset cost drivers at the same time and look at systems changes to address quality issues and increase access to families. So the state is currently engaged in cost modeling work for EI to look at what is the true cost of delivering services. We've also just completed cross-state research looking at critical issues related to the workforce and how other states address those. We're also piloting some modified service delivery approaches for families with complex needs. So with all of these changes on the horizon, we know that there's much more work ahead, and we remain hopeful that our state leaders and legislators will keep the children and families who are impacted at the center of everything that they do. And with that, I will pass it to Libby from Louisiana.
Thank you so much. I can't even imagine getting $40 million in the state budget just for EI. I just needed to say that because you have that's incredible, a lot to be proud of. I'm going to drop in the chat in a moment, the link to the study that we did with Build, really related to promoting early intervention in Louisiana to really increase the enrollment that we have in our Part C system. And here it is there. And so, you know, as I talk through this today, it's really coming from a place of we had a list of recommendations that we were working on, but the places that we've really seen some bright spots and moving the needle forward is related to developing a public awareness marketing campaign and promoting expansion of developmental screening. One of the things that came up through focus groups and talking to people in our early intervention system with our parents and all those types of things is like, what if we had an app to like help unify the system and think about screening and those types of things for better or easier entry points into the system. And what we've seen throughout the state in different pockets are things like the Bright Moments text and really linking those developmental milestones so that if parents know what to expect for their young children. And while it's not a coordinated fashion statewide, it has, we do again have bright spots throughout the state that we're seeing that, as well as our childcare providers being a part of that texting and app campaign. When we looked at the number of referrals and who our main referral sources were in the state of Louisiana, what we found is that some of the lowest percentages of referral sources were our early care and education providers and Head Start and early Head Start providers, which seems kind of wild because that's where the little people are, and you would think that those places would pick up on those areas. And so one of the things that we have done at the Policy Institute as an organization that really, you know, worries and thinks about policy and data all day long, and also what does a coordinated system look like that you have families that have a net that works for them. So we all have networks that we're working around in and day out, but how many of us really have a net that works for our families? And so that it's connected and cohesive. And so one of the things that we've really worked with both our Department of Education within the early care and education side of the work, but also within our early intervention side of the work within our Louisiana Department of Health is really about promoting expansion of developmental screening. And with that, we have promoted it with, you know, not just early care and education providers, but also within our healthcare providers, because we can all think about many times that we've heard families say, well, my doctor told me to wait and see. And so let's get past Dr. Wait and See and get into the now. I will tell you, I teach on the side a little bit, and I've dealt with residents and people that are in medical school, and I was like, I will haunt you if you are Dr. Waite and Dr. C. We really want to make sure that these developmental screenings are happening, but also we had a point in our state that developmental screenings, the little checkbox on the computer for Medicaid reimbursement wasn't checked. And so those things are happening now. But what we've done to think about this strategically and to think more cohesively system-wide is how that we as an organization outside of government can help support government to apply for these larger federal dollars that would make systems talk to each other and be more cohesive. And so what we have done is we help support the writing of the Early Childhood Comprehensive Systems Grant, talking about health integration prenatal to 3 with our Department of Health. And right now we're in the process of planning for a maternal innovation grant. Again, with the hopes that these developmental screenings and these other systems are all together working to make sure that we're capturing the families that we need to be able to support the families. What we've seen within the department, with the Department of Health working with the Department of Education work, is really some strategization to promote awareness of developmental delays and the importance of referring to early steps. This is important too, because for these kids that have, you know, if they have an IFSP, that they can then, if they're in a child care center, they can actually have a higher rate for childcare assistance in the state of Louisiana. And it's a significant chunk, especially if we're talking about these little ones that really need more support in childcare settings to make sure that the teacher to student ratio is lower. So again, by promoting developmental screening by childcare providers as well as healthcare providers, but making sure that that system is talking to each other, because I think that many times what happens is children are screened and rescreened, but it's not put into a system, and then those screening results aren't necessarily valid and reliable. So we have worked, that's one of the areas that we have spent some significant time in the state of Louisiana working on. All at the same time as we have a new Part C coordinator for Louisiana, and she's been in our system for about a year. And so I think that there's more good stuff coming our way because we have a new mind that's helping us to think outside of our box in Louisiana. The other thing to keep in mind for Louisiana, as I've heard other states mention, you know, they have private pay and Medicaid. In Louisiana, there is a law that prohibits just some kind of quirky law, as Louisiana often does have, that prohibits private health insurance, the state billing private health insurance for EI services. And so, you know, just thinking about the different barriers in place and how we think about that when we really think about how do we increase enrollment in early steps. And again, we're working on the screening, talking about and thinking about and really dreaming about how do we get to a less restrictive space for eligibility, to where it's easy, you know, it's not as easy to get into Part B, and it's a lot easier to get into Part C basis of the work. And then, like many of my colleagues have said today, is, you know, we have a provider shortage and reimbursement rates that are quite frankly, ridiculously low. But what we also know is if you touch a child, that you're going to get paid less. And so that's also a value proposition as we talk about early childhood at large, but particularly we talk about early childhood related to young children and their families with developmental disabilities. How do we support that work? And what we have seen in Louisiana too is the disability community always knows what they need, and they always step up. And so we've seen some incremental increases with rates, but nowhere near what it needs to be, but the momentum is there. And because the disability community is so connected, I still think that we can move the needle for young children in Louisiana in this way. So Karen?
Okay, everyone, take a deep breath because we know that was a lot of information to share, but I want to reflect myself that I'm just really taken with all of the amazing work that's being done by the panelists in their states. And also I've been reading through the chat and seeing so many of not just the shared struggles, but also things that folks are doing. There's just so much for us to build from, no pun intended, build. And also I think the other thing that is, for me at least, really important in this conversation is how everyone is able to focus on, well, we have these tensions, we have these waiting lists, we have a workforce crisis, and at the same time also talk about, and we're also doing the work to make sure that we are serving all eligible children, that we are still going out and finding children that are eligible for these services, because we really do know that these babies can't wait, right? And those are like sometimes dissonant things to hold and also to explain to policymakers. And I'm really taken, even in this short presentation of work that's happening, how all of the panelists are able to attend to both things at the same time. And I think really the needs of these children and families demand that we continue to do so. So we thank everyone for being here. And I know that Build is gonna wrap us up and that they're gonna help us to find ways to stay connected to one another. I think I'm passing it to Michelle. Is that correct?
You are. Thank you, Karen, and thank you, panelists. This has been a great, great conversation. I know that there are lots of people in the audience who are definitely affirming the issues that you were talking about, and I know they learned a great deal from you in terms of the initiatives that you are taking on. Just a couple more things. The Prenatal to 3 Capacity Building Hub is a program of Build, a project of Build, and we are funded by the Pritzker Children's Initiative. And I didn't want to forget that very important piece of information. And you will see on your screen an invitation to join the Prenatal to 3 Exchange today. If you are not a member, we would love to have you. It's a place where researchers and practitioners and thought leaders and many, many others involved in the Prenatal to 3 arena. And they is a place to gather. It's a place to ask questions. It's a place to get resources. Yes, the link has been dropped into the chat. So if you aren't a member, we highly encourage you to join today. Do it right now. So again, thank you so much for sharing some of your day with us. If you have additional questions, there's an opportunity in the evaluation to ask those questions. So please fill those out and we will send them to the appropriate panelists and get those answers for you. So thank you so much for being with us today. We'll see you again soon. Bye.